So hello and welcome guys. I just took a complete live class on gestational trophoblastic disease live class with you, and it's very nice that despite the exams just finished around the corner, many of you did attend it, and I was very happy to see the participation, the spontaneous answers which I keep, the questions that I keep asking in between the session. Many of you were, it was not a very common topic, but many of you were very well prepared, were answering pretty well. I don't know whether you just finished the exams or you were preparing for the upcoming March session, but it was very encouraging. So what I'm doing today is I'm just taking a very crisp class and I'll put it on the YouTube so that people get to revise these last minute concepts in a less amount of time. So I wouldn't just keep the introduction just very short. Let's just jump on to two important things about GTD. Right now I'm focusing on gestational trophoblastic neoplasia because I'm mostly talking about the staging of GTN and the risk assessment. So you usually fumble with these two things in front of the examiners, and I'd like to just pause and tell you that it's very, very easy to remember these two concepts, and after this class it'll just right be there in your mind, and you would not forget, you will not fumble. Just stay with me and watch closely how I proceed to take you through the staging and risk assessment. Now, when I was taking the live class also, I told you this thing in a very short, concise and proper manner. The tip to remember, the staging as well as risk assessment. Let's first think about the staging. Is the most easy staging that you can ever think of. So the staging is, first of all, the GTN limited to the uterus alone, which is what? Stage 1. Stage 2 becomes neoplasia is now encompassing the adnexal structures. Okay, structures around the uterus. It's gone away from the uterus and now it's there in the adnexal area. That's stage number 2. Stage number 3 is mets in the lung. That's stage number 3. And mets anywhere else becomes stage number 4. So simple as that, that's the staging for GTN. And now let's focus ourselves on the risk assessment, the GTD risk score or risk assessment. Now remember one thing, first of all, that this is 0, 1, 2 and 4. It's not 3. So first of all, the examiners are going to confuse you over here because you're so busy in memorizing this part and this part, you sometimes forget the score is 0, 1, 2 and 4. It jumps on to 4. And always remember the final conclusion. That means if the score is more than or equal to 7, it's high risk GTN. Alright, mostly for most parts, in most of the books it's 7 as the the cutoff of high risk score of for the GTN. That's one. Now, you have to remember these variables. So there are 1, 2, 3, 4, 5, 6, 7 and 8 variables, out of which 3 depend on just the history alone. So if you're asking the history properly, you're done with 3 variables. 3 risk assessment scoring variables. And the remaining 5, they're dependent mostly on the diagnostic tests for the patient. Correct? So what you do is, remember these 3 parts. Obviously you're going to ask the age of the patient. You will ask what was the obstetric history, okay, what was the antecedent pregnancy and how long has it been from the antecedent pregnancy to this point in time when the patient has approached you. So these are 3 important variables. What you have to remember in this is age is in years, the antecedent pregnancy is antecedent pregnancy, and the interval is in months from the antecedent pregnancy, whatever be it. Out of which, of course, HMOL is a lower risk, and full-term pregnancy becomes the high-risk pregnancy. Now, I'll talk about the other important variables. What are those important variables? Are pre-treatment HCG levels. You have an international units per liter, so pre-treatment HCG levels is very important. Largest tumor size is very important. Site of METs. How many? Size of the tumor is in centimeters. Beta HCG is in international units per liter. Number of METs, how many METs are there? So there are more than 8, remember it's high risk. If it is more than 5 is also towards high risk. Okay, but if there are no METs or there's just 1 or 2 METs, then probably you can think about. So I'll get to this scoring part a little later. Let me just focus on what the variables are. Site of METs, again important because like I said, lung is very easily involved. So it's the early part. Okay, so lung is, towards a lower score. and previous chemotherapy failed automatically becomes a high risk point. So now let me just focus on how to score this from 0, 1 to 4, and how to remember, how to memorize the scoring of from 1 to 4.